Alrighty, ladies. So what we'll do is we're going to continue the second half of the process, which I mentioned to you all, which was the actual fourth station, administration. Well, basically preparing and then administering the insulin to your patients. Correct? So you all learned how to use the protocol. You understand how to select your insulins. Correct? Which type? Am I on the right page? Are we good? So I'll do the next demonstration, and then you will practice it yourselves. And I'll give you, again, one of the, you'll use the protocol, and I'll give you the time of day, and then you'll just pretend like this is that type of insulin. Okay, so I'll try to pick one that's not mixing. If I'm able to, I'll get a second vial, and then you can actually have two if you need to. It's for you to decide, dependent on the type of insulin, right? Mm-hmm. That was part of your homework. So the first process is, and I'll mention is, when you are preparing insulin for your client and you decide on how much to administer, you need to, for example, write down all the information on the label that you're going to put on your patient's syringe. So don't forget to take notes, because you will all be doing this afterwards, okay? So for example, we're going to say this is again for Miss M. So I'm going to go Miss M, and then whatever room number she's in. And then once we finish looking at the protocol, we're going to determine the amount of insulin to administer for her. So I'm going to basically say it's supper time, and today we'll pretend like it's October the 6th. And I got, if you're all on the same page as me, yeah, so we're October the 6th, right? So again, Miss Mary or Miss M, whoever it is, room 1, 2, 3, 4, 5, 6, or excuse me, let me restart that process. So this is for Miss M. MRN number 1, 2, 3, 4, 5, 6, they match, correct? This is done 4 times a day. So now you're today pretending to be October the 6th. I go to PM, which is supper. What do we get? As the millimoles? 10.2, perfect. We plot that into the sliding scale. What do you all get?
5 units.
What do you, 2 of what?
5 units of human.
Sorry, step by step. What did you get? Sliding scale you got? So we're going to take a step back. In the sliding scale, how many units did it say? Okay, so you need to write down 2 units. So Humalog, 2 units, and then you're going to add whatever is in the baseline. So it's always plus baseline. So you don't combine it right away because you might make a mistake. Then you go up for supper, and it says how much in the baseline should we administer? 3 of what?
3 of human.
Okay, so Humalog 3, when you add them together, because they're the same, right?
Mm-hmm.
Now what do you get?
5 units of human.
Beautiful, 5 units of Humalog. Now we're gonna come and get our equipment. So at this point, we need to gather all the supplies whenever we do an injection. So what do you think we need? Off the top of your heads, do you know what you need?
Injection.
Okay, injection, so what does that mean?
Syringe.
Syringe? So right, we're gonna pick the right syringe. What else do you need?
The alcohol swab.
Okay. Okay, perfect. So you have an idea. Always write it on a list so when you're in the process of implementing it, you have all the supplies gathered before you call me, so that we can from there go into the patient's room. Good. So I'm gonna pick the right syringe. Okay, there's 2 here. I need to read them to make sure what the syringe says. Okay, this is not the one I want, for example. How do I know? It has to say what type of syringe am I looking for? Good. So this one says insulin syringe, and I look to see when it expires, 2029. Are we good to use it?
Yes.
Okay, so I'll take this syringe, and it comes with a needle. You told me I needed alcohol, I heard you say. Gauze, and then we need the type of insulin that we're going to be administering. Here I put Humalog. Obviously, it's not really Humalog, it's just sterile water, but I want you to pretend like it's Humalog, right? So when we look at this vial, we're going to look at what on the vial?
The name of the medication.
Good. So we're going to pretend it says Humalog. Right now it says sterile water. What else do you look at on the vial?
Expiration date.
Okay, the expiration date. I agree. So 2027. Anything else?
The time it was open.
The date.
The date it was open.
Beautiful. So we don't have a date, so it's brand new. So who puts the date on when it's brand new? We do. So yes, I would put the date on. So I would write on here if I had a felt pen, I think one of you, does anybody have one of those Sharpie pens that writes? Mine, I can try, you do? Thank you, I'm gonna borrow Sharpie, so I would have to write it in, say what, so we know it's for October the 6th, but we're gonna use today's date, whatever date, where are we today? Third. Oh, please can you go around, you're late, please can you go around, no, can you go around, please, you're late, thank you. So, I will resume the process. So we will write the date that we opened it, which is today, April the what? Okay, and then we put the year, okay? So is there anything else we're missing to check? Beautiful. We look at the concentration, and usually it's, what is the concentration of the drug? For Humalog, what's the concentration? The concentration, you said always clear? The concentration is always, what does that mean, always clear?
Okay. 100 ml per
So, I'm sorry, one person at a time. So, yes, Madame Beloli, what do you say it is?
Isn't the concentration you mean in liquid is clear?
What does the word concentration mean? Concentration of a drug.
How much is it?
Okay.
Okay.
So 100 ml per 1 ml.
Okay, so Balani is saying it's 100 ml per 1 ml. Who agrees?
By 1.
Okay, so,
I think you.
okay, that's what Balani is saying. Does anybody have anything different? The concentration? Do you know? I think, I think, Sherilyn, you were saying it. What was the answer?
100 milligrams per unit.
Okay, so you're saying 100 milligrams per unit, or, okay, 100 milligrams per ml per unit. So we need to go back, we really need to go back and check, okay? How the concentration of insulin is always in, and I've never heard it in milligrams per ml per unit, I've never heard it in milligrams or mLs per ml. So I want to see if somebody can find it for me. If they can, and if you cannot, then I'll go and get a real vial for you. Actually, I'll pull it up on the projector so that we can make sure we're on the same page. Okay? This will help you.
So 100 units?
Beautiful. 100 units per what?
Milliliter.
Great. 100 units per milliliter. That is correct. So any other answer is wrong. Okay?
It says though the units 500 insulin is available for patients who are extremely insulin resistant.
That's a different one. That's extremely, we're not dealing with that in the hospital, we're dealing with,
It's 100 units per milliliter.
that's right. So you need to write that down in your notes as well so it's very clear for you, okay? 100 units per ml, and then I'll find you, I'll put up the presentation.
Units per ml, milliliter.
Perfect. So I make sure that that's what I have. Then I need to make sure that the person, obviously you're gonna inject it into your patient's, either their outer aspect of their arm. How far from the umbilicus do we inject?
2.
To what?
Finger. 2 inches.
Thank you, Anna, 2 inches. Okay. And then, or you can do in the outer aspects of the thigh. So now you know the regions. So once you have everything planned out in your mind of how you're gonna proceed, don't forget you need your 2x2 swab. We already have the identification of where we're going. So now we would prepare the insulin. When I open the syringe, you will all do this afterwards. I'll provide you all the supplies so you'll be able to do it. You open up the package. The first thing that you do, because it's brand new, we remove the cap. I'm gonna ask you, when I remove the cap, do I have to do anything? Do I have to clean it?
Yes.
You're saying no?
I would say no because it's brand new, but if it was used, I would clean it.
So the answer is yes, because it's just a dust cap. It doesn't mean it's sterilized. Okay? Alcohol is what we use to sterilize it. Supplies, right? So then we clean it. While we're cleaning it, I know how many I'm gonna pull up because I wrote on the card on the patient's identification information, Humalog, and I put the 5 units that we came up with, and then I'm putting the expiration date, which we said was 2026. Then I'm gonna pull up the amount of insulin that I need, but before you do, you need to release the suction inside the plunger. So there's like a negative pressure, so you have to pull down and then up, and it releases there's like a pressure inside of it, okay? Then you go directly to the number you're gonna be administering, so units. And don't forget to check the calibration of the syringe that you have to make sure it is in units and how much. So this goes to 50 units. The calibration is how the increments of how it's going up. Sometimes they're going up by 10, by 5. So in this case, it's by 5. So you know that it's in increments of 1. If it goes to 10, usually it's in increments of 2. Good? So this one's in increments of 1. So I pulled up my 5 units of air. I cleaned up the vial already. I'm going to inject it into the vial. I push air into air. I turn it over. You saw that? And then I'll draw down more than I need because I need to get rid of the air bubbles. So I draw down more. And I keep my fingers in the shape of a C because it's more comfortable. See the positioning of my hands? You will all do the same afterwards. And then I'm going to, there's no air bubbles, or if there are air bubbles, you just push it all back up. All of the fluid, and you come back down. Make sure you get rid of all of the air bubbles. If I still have, push it all back up. And then, usually the next time around, you should have no bubbles, like no microscopic bubbles. You'll see them when you're doing it. And then I'll go directly to the number, and I'll go to my, how many, I said 5 units? And it's where the end of the black, I guess the plunger, ends at the number, okay? After that, you need to verify with somebody. So at that point, I would call Anna and say, Anna, please, can you come and verify the insulin with me? And she would make sure that what,
Oh, yes.
and she would come, because it's always an independent verification. So now, Anna, no, you have to go and look at the paperwork to make sure that I have the right amount. So it's this, and I got 10.2 millimoles was the blood sugar. So she has to do her own independent verification to see how much I should have in my syringe. Does that make sense? So what'd you come up with?
So 10.2, and then on the sliding scale, it's 2, and then
2 of what?
2 units of Humalog, and then the baseline is 3 units, so we're gonna get 5 units of Humalog.
Okay, then I will show her what I have. After that, she will check to make sure that it's the right drug.
It's cool.
She said it's good. Usually they check the right drug, they'll make sure that it is Humalog, they'll make sure that it is not expired, they'll make sure that when the last date it was opened, and they'll make sure that it is the right amount. It's verified?
Yes.
Then you will put the number down that we got, so you can just pretend like, so you don't have to write on the paper, so it would be, she would put 5. Then, don't remove the syringe while she's near you because you can poke her, right? And then afterwards, you make sure you place the cap first in a place that's not gonna roll around. Then you take out the syringe. I usually take it out this way, so it's easier for me to put it in. You saw what I did?
Mm-hmm.
And then, usually they'll say push it against something first, and then you click it. Good? So now I know I have the right amount. Do you just go into the patient's room now with the alcohol and swab? What am I missing? I'm missing the label. So I wanna see, I don't want you walking around without labels because that's dangerous. So either you can remove the whole label and wrap it around, or you could have put half the label, and then what I like to do is I rip it off, and then when I wrap it around, I'll place it. Always place your label beneath where the number of the medication you're giving is, and then you wrap it onto the paper and it usually sticks. Okay? That's how you would do it. Then you get all your supplies and you go into the patient's room and then you inject. So in this case, we're gonna inject into this patient's abdomen. This is, so the direction of the injection depends on how much fat you put between your hands. So we'll say this is in the abdomen. The belly button is, we'll say here. So I go at least 2 inches away from the belly button. So I'll be here. You clean the site. He seems to have a lot of adipose tissue, so I can go in at 90 degrees. If he had less than 1 inch, then you would go in at 45 degrees, okay? So I clean in a circular manner. The only thing your teacher's missing is what? Oh, good. So I shouldn't have even gone into the room. I was trying to see. So we need to have gloves. So never, pardon? Trying to see if what? if anybody was gonna point it out. So, because my students walk in without gloves. So remember, you can never give an injection without gloves. Okay? So, you go into the room.
I forgot to check that.
Ah, good. She learned. Yes. So and that's what I see people going in, they just give the med. So you check the patient's ID. So Anna is my patient, check the ID. Oh, okay, Anna. And then her first and last name, or last name. And then I get ready. I let them know what I'm gonna do and prepare for the injection. So always gloves when you enter the room with your supplies. Good? And then when you enter, what else do you look for in the room? What do you look for while you're in the room? Oh, okay, the sharps container has to be somewhere visible. Sometimes it's on the wall, sometimes it's on the table, you need to find it. Then you would make sure that you expose the area. Again, 90 degrees when the patient has more than an inch of fat between your fingers, when you're grasping more than an inch, 45 degrees if it's less. Then you clean the skin. So I'm gonna go here and angle. I don't know if you all can see. And then you remove the cap. Some people are struggling to remove the cap. Sometimes you can twist it and pull. I hold it like a dart. I go close to where I'm gonna inject. And then you can let the person go, okay, and I'm gonna go on 3, 1, 2, 3. And then you just do don't inject hard, just a nice little slow injection of the needle. Then you inject with the thumb on the plunger, slowly. Yes. One second, I have a needle in my hand, sorry. Then when I'm taking out, how long do I wait? 5 seconds? 5 Mississippi. I take it out, and then what do? Put it into the sharps container directly. So because of the label, I can't get it all in, but into the sharps container. Do anything with the patient? No, I just leave them there with blood? Oh, okay, then you would check to see if there's any bleeding. Some people had blood, depending on where they went. So you always have your 2x2 to check. You don't want to get their clothing with blood on it afterwards. You put pressure, never, it's always pressure. You don't want to rub. Then say thank you, cover them up, and then you throw away your garbage. Is that good? Clear for everybody? Okay. So I would.
Question is,
Yes.
so with the gloves thing, so you wear your gloves at the med cart, or do you wear it inside your room?
When you're going into the room. So at the med cart, you don't need gloves to be preparing it. It's really when you're going to inject it into the person's skin, because you're dealing with blood. Thank you.
And just to ask, is it true that if you inject the insulin too quickly, it burns the patient?
That's dilated burns when you inject too fast. Not.
When you wipe the alcohol, do you have to like sit in the mouth 2 seconds before you?
So it's a good question. So if you're injecting into a port like an NS flush or whatnot, the amount of time is 15 seconds. When they're cleaning the cap of one of their of an insulin vial, usually I think it's like 5 to 10 seconds they do. But I'll get the quote. I don't know the exact number, but it's not as long as when they're injecting it into the person's like IV or, you understand what I mean? So I could be wrong. I'll correct it if I am. But I believe it's about 5 to 10 seconds. Good. Is that good? So now I want to have you all practice the same process. Make sure you're comfortable with it. Okay.
With insulin, after you inject, I know you're supposed to rub it, but some people rub.
We don't rub.
No.
We just hold it down. You're not supposed to rub.
I've seen some people rub instead of just like wiping.
So you're just putting pressure onto the site to stop the bleeding if there's bleeding.
No, I know, but I remember in school they said it's a reason why you don't rub, but I've seen people like after they inject, they rub.
If you see people in industry doing it, doesn't mean they're doing it according to evidence-based practice. Like they're not doing it properly. You're not supposed to be rubbing after you inject. It's exactly what you're taught in school. You put pressure to the site, especially if it's heparin. You don't rub after you give heparin because you're going to cause it. Either you're going to cause the person getting ecchymosis. You don't want hematomas developing. So never rub. It's always just pressure. Is that good? So I'm going to go on to the next process now, so that you all get the opportunity to practice it. Okay? So I'm going to give you supply. Well, actually, I'll let you each come, so you'll move your material in a way that so you'll be able to work at your desk. And then you'll come and get the supplies yourself for the injection. So you can practice. I think that's the important part. That's okay if you're wanting writing notes. So get your supplies. The other little, this spongy thing here is basically, we'll say it's the patient's abdomen or the back of their arm. Something you inject into. Okay? And this here, I will get the If you have any questions during the process of your preparation, I will absolutely answer them. And we'll pretend like this is where the insulin goes. That's fine. Oh, and I forgot to mention, so because I was so close to the actual place to inject, I didn't do one thing, and I'll show you what to do. When you are dealing with a needle and you have to walk across the room, or you have to walk a distance away, the most important part is, I'll pretend like this is the syringe I was dealing with, or the needle. When you come out of the person's skin, put your hand up in the air, like you're just gonna turn, don't manipulate in any way, just take it straight out of the patient's skin, put your wrist up, and then needle, because she's coming near me, needle, and then you drop it into the sharps container. Does that make sense? Is it clear? So, the needle, you always want it up in the air. Right? Because if it's facing downwards, there's a risk of you dropping it onto your foot. If it's facing outwards, you can poke somebody. I could have poked her walking next to me. But when it's up in the air, there's less of a risk of you hitting someone. If they do bump into you by accident, they're going to hit your hand. Is that clear for everybody? Good. So you can you'll basically, put up on the board, I'll put up the same type of insulin. So for you, I'll just give you the amount of insulin you need to draw up. I think it'll be a little bit easier. Since you all have, we already practiced the how to use the insulin protocol. So your patient, we did the check, and we came up with 8 units of Humalog for Madame Anna. Okay, so now Madame Cheryl, let's write down. Sherilyn, your patient came up with 12 units of Humalog. No, yeah, that's fine. For Jasmine, your patient had 6 units of Humalog, which you need to administer. For you, Mademoiselle Crystal, your patient had 7 units of Humalog. And then for Madame Bolani, your patient had, I'll say, 11 units of Humalog. Okay, so you can prepare your patient for the administration. If you have any questions on here, you're kind of trying to make sure that you understand how to do it. And then afterwards, I feel you have a patient with insulin. You'll be actually able to inject it into your client. Same process, okay? Good, so all your fingers are holding it. And then, Jasmine, again, your fingers should be around the neck of the vial. So where's the neck of your vial? There we go. Those are 2 fingers. Now it's more stable so that you won't bend the needle. Because if you bend the needle, you have to restart the whole process. So let me see your fingers. That looks good. So if you have a lot of air bubbles, you just push it back in. Your needle is bent, so your vial is not straight. It has to be straight. So keep your hand straight like that. And then your needle's bent, so keep it straight. Okay, and then get rid of the air, maybe push it back up. And draw up more than you need. Don't just go to like the number. Draw up more, check to see if there's any air bubbles, and then if there's none, good. You need your finger, yeah. Let's see. holding it around the neck of the vial. So your needle is bent. So can you continue?
No.
No, you need to get a new one. It's completely bent. So you can't. So your sharps continues over there. So again, you'll practice the walking with it. And you put it away here. So if you're done, let me, oh, when you're done, leave it inside, darling. Remember, I have to verify. Anna had to verify it, because now it doesn't count. Right? You could have taken it from any vial. Now you dropped it. So can you reuse the needle when you dropped it? So it's no longer viable. Let's get you another syringe. I'll be with you in a moment. I'm gonna get another syringe. You're welcome. Anybody else with a bent needle? You're good. So your fingers around the neck of the vial. The neck of the vial. There you go. That looks good. Okay, so I gave you. What's your final answer? You have to have your final answer. How much insulin to drop on your paperwork? You should have your final answer. How much insulin to drop? Good. Here. Your needle's being bent. You need to keep it straight. There we go. Good. Good. Good.
Miss, I have this here 18 is in my life.
Okay, we usually write things. It looks like something else. You usually put the name of the drug first,
Okay.
and then okay. Now let's see. Makes it easier. Charlene, your fingers around the neck of the vial. There we go. Is that better? And if you have air bubbles, just push it all the air back. And then, okay, let's see. So you'll turn, so I'm looking at the vial. Okay, it's the right insulin. Okay, I don't see the date that it was opened. How come? You didn't mark the date that it was opened. I think it was brand new. There was a cap here.
Okay.
Okay, so it expires in 2027. And then you have 8, let me just, sorry, it's hard to see when it's low. 5, 6, 7, perfect. 8, yeah, you did the right thing. So now you'll put the cap on. Want to see how you take it out? Yeah. Good. So your fingers, just to help you, if you bring your fingers a bit back, bring them back, and then relax your fingers, make them into a C. So bring these fingers down. So hold on to, like, use that to hold and bring your fingers down. It should feel like a C and it's less tense. And then you kind of pull down. Is it better? Okay, so you have the right insulin. I don't see the date that it was opened.
My pen
Try. Okay, we'll use a Sharpie next time. Let's see when it's expired. Good, it's the right concentration. And you have 7. Good job. No, not ready? I see. When I hear the clicking, it means you're not ready. Anybody is stuck? You ready? Okay. I'll go to her first and I'll come to you. Good. So, right insulin. Sorry to turn this a little bit. Oh, good. The date that was opened. Expiration. Excellent. And then you have 12 units. Good. You can put the cap on. Good job. That's yours. So this is the top of insulin. I'm looking for, sorry, the expiration date. I don't see an expiration date on your vial. You didn't. Beautiful. Now it is. And then the date that the vial expires, 2027. Good job. And then now I see that you have 11. Is that correct? Yes. Good. So now you can put the cap on. Good. So if you do it that way, put it in the middle, just as long as it's beneath. Yeah. So as long as it's beneath the number. There we go. Excellent. As long as it's beneath the number, way beneath. Why would you put it on the line, darling? Way beneath where you're gonna go. Yeah. Okay. So be careful with the needles.
Yeah.
So be careful with the needles. Put, do you have a 2x2? Take the 2x2 that's right in front of you. The 2x2, darling. Put it on your finger. And then don't take the needle. Well, it's your It's your blood, so you'll pick up the syringe after, but put pressure. Is it bleeding?
No.
Oh, it's not bleeding? Oh, we'll just put pressure anyways, just in case. So you'll leave yours down. Get rid of your garbage, and then we'll start to do the injection part. There's two ways of doing it. Yeah, you can do it like that, but it's not probably not gonna stick, so maybe you put out the whole thing. If you like putting it in the middle, just put out the whole thing, all the way. Yeah, I have another one. Just take care of your finger first, and then afterwards you can do it. You'll probably wear gloves. So your needle's really bent. See, it's completely at a 90-degree angle. Okay? That's okay. So we can always fix this. When you do this, you can adjust. There you go. Then you can put it in half. So now you're going into your patients. Everybody's ready to go into patients? You can restart the process. When you're ready, you can restart the process. There's a syringe here for you. Okay. So this one, you did great. You have patient's information. Now you're going to inject into your, I don't know what it is. Patient's abdomen, you can borrow mine. So again, ID, excellent. What are you looking for in the room?
The sharp.
Good, so my ID, it's right here. Starts container is where you find it. Okay, so now the three of you, I'm watching. You can go ahead and clean up your mess, darling.
I don't have an alcohol swab, but I will.
Oh, you need to get your alcohol swab done. That was for you. All the supplies were I prepared for you. Everybody, so the rest of you have all your supplies?
So I will hold and grab and,
Yeah. So, Jasmine, when we mentioned that we're not gonna have the needle up in the air without the cap on. Keep the cap on the next time. It's okay, just for the next time, because in case she puts her hand up to grab, she doesn't get poked. Good? Yes. No problem. Okay, so ready for the three of you? So one at a time? One at a time, I'll start with you. So you clean?
I clean,
Okay.
open.
Okay.
I'm gonna hold and I'll go in,
Okay. So you let them know. You need to let your patient know I'm gonna go in. And so they're aware, sometimes they freak out. Okay? Okay. So, what is she doing wrong?
Oh, pass it down.
Very tough.
Sorry.
I'm like,
So, I hold 5 seconds, and hold out, and then.
up in the air straight. No, no. What's
Change
your name?
position.
Go back down. No, hold, move this. Move this. Why would you move it, darling? I need this to be where she walks. Okay. Yeah, the way we do it. Okay, if you want. Hold it in the air. So, I'll say do it again, but you never want to, because the way she was doing it is how she's gonna actually take out her patient. You would never let go of the syringe when you're in. So, there we go. You inject it. Watch your needle, not me. Is it up? Is it straight? There we go. Good. Perfect. Don't worry. You got it. And then what do? Come back to your patient. You never check for any bleeding. So you also forgot your 2x2. Okay, so you'll redo the process after. Okay, so I will do yours. Go ahead.
Okay, so I'm gonna go to the patient's room, I'm gonna verify the patient's bracelet, check for the sharps, I'm gonna explain to the patient what I'm gonna do. I'm gonna open the site,
Mhm.
I'm gonna wipe it,
Disinfect.
disinfect. Okay,
You can help each other. It's okay. Okay.
I'm gonna tap it,
In the air. Hold it. No, hold it up. Yeah. There you go.
this.
Not from up here. You want to get closer to the person's skin. You don't want to jab from all the way up here and then go into the patient. That's very bad. You want to get closer to the patient's skin. Get closer.
Then I'm gonna tell the patient that it hurts, but just a little bit.
So go be a little bit closer to the person's skin. Okay. Okay. Good. You hold it. You inject with your thumb. Okay.
Oh,
You see that? So
shaking.
you should have held it with these two fingers and then inject. Okay. So take some deep breaths. Take some deep breaths because you're shaking.
No, it's normal for me.
Okay. Okay. But you're letting go of the syringe. Don't let go of the syringe when you're administering. Because you don't want to cut the person's skin in any way.
And then I'm gonna count 5 seconds.
Okay?
And then I'm gonna repeat it.
Yes? two faces. You have it up in the air. What do you say? What do you say?
I'll come back for you.
No, needle. I'm right here.
Okay,
Needle.
needle.
You have a needle in your hand. You need me to be aware of it.
I have a needle on my head.
Keep walking.
Sorry.
The thing is, I'm walking here.
Okay, and then I'm gonna go back to my patient. And then
Okay.
I'm gonna wipe it.
Okay.
I'm gonna close it.
No, you don't want to wipe it. You're gonna put pressure on
Oh,
it.
pressure.
See if there's any bleeding. Okay, we're gonna practice this more.
Oh my God.
Okay, your turn, darling. Go ahead.
Okay.
So I'm gonna check the blood, check if you have the sharp container, and then check the settings. So Mrs. N, my name is Sherry, I'm next to our teacher.
So you guys, sorry, you don't have to give me the whole background and pretend like you're talking to the patient. You tell, that's correct. And then you're going to do what?
See, so I'm gonna ask the patient to
Beautiful.
lift the shirt. And when I cover it, I'm gonna wipe the
Yeah.
skin and.
I want you to actually wipe. It's not a fake wipe. That's how you wipe. You just dab. How did I do it? Okay. You actually disinfect. Beautiful. Then,
Oh, wait, before that I have to.
yeah, 4 inches away, 2 inches away, sorry. 4 finger breadth. Okay. We don't have to tell them it's gonna hurt a bit. Maybe it's not gonna hurt. Just tell them you're gonna go in. Okay. Sorry, you inject. You haven't even injected it. You're trying. Gotta inject. And then you. She's so funny. She just put the needle in, so it's counting. I'm like, oh, what are we counting? You got a needle. Good job. Okay. Okay, I'll take care of it. Don't worry.
Miss, I didn't get the part where you told me to say needle. Why? It's because you're
It's
there.
because it's
Because we
there.
mentioned it. There's nobody around. You just say
Yeah.
needle.
Because I was pretending you're not there. that's
Why?
why. No, I just thought.
When she was there, I didn't pretend she was there.
Okay,
It's not
so
imaginary.
if there's someone, just say needle.
Yeah.
Get out, needle.
Date on your vial to see when we open it. On the vial, because you open it next to it, put it directly on, and then the expiration.
Like put the pen here?
Yeah, anywhere on it, as long as it's, we can visibly see it, and then you got how much. Let me just borrow it from you. Sorry. You have So maybe when you're putting it in, see how there's liquid coming out? There's something that you're doing, you're bending the needle too much, and you made the whole, the plunger big. So I shouldn't feel any liquid, that means you would feel the insulin, it smells really strong. So we're gonna redo the process, because right now there's a drop coming out of insulin. The number, you wanna go a little bit, it's good, but you wanna go a little bit up, so it's directly on the line, sorry. Directly on the line, and then just no liquid coming out. Okay. So I feel like it's loose because here, when you hold it more on the neck, you're pulling down, and it's gonna be less of a movement of the syringe. You understand what I mean now?
Yeah.
So now you can take it out and put the cap on. Yeah, I'm coming, darling.
I check my wrist,
Okay.
then I look for the side. I'm giving on the upper hand. And take the measurement.
How far?
It's 2 units.
So she said the measure that she's gonna go is 2 units from what?
If I'm going from belly button.
Okay, so can somebody help your sister out? She said it's gonna be 2 units from her belly button.
It's 2 fingers.
Listen to her.
Oh, 2 inches. Sorry, 2 inches.
2
Then,
inches.
then
Yeah.
I wait
Good.
10 seconds. Look at the needle.
Yes. Good. So on one
watching you.
So if anybody has any questions, you can ask me, or like how you all both are practicing, that's awesome. And the collaboration, keep going.
I go 45
Good.
degrees.
I'm seeing, good, your needle straight, good. And then why did you let go of the complete needle? You always hold the needle because if not, you can bend it and still cut the person. So you don't inject and then let go of the needle and then place your fingers.
And then do it again.
Yeah, then let's go with the injection process again. So take it out. Okay, so you want to hold it like a dart. So your fingers are holding it. And I'll just say this finger here, I'll be holding it like a dart. Okay? So that, keep your, careful. So then when you go into the patient's skin, you go in, 2, 3, and then you're holding, and the thumb that goes here. There we go, that's better. You see you didn't let go? Good job. And then you inject. Because if you let go of the needle, imagine I'm into the patient's hand and I let go of the needle. It can still, is it gonna stay? So that's why you have to still stabilize it. So you go in, and you're still holding it between your 2 fingers. Your needle next, oh, come back, sit down. Take it out one more time. So go back in the skin. Just want to see the process of you coming out. Okay. So go. So pretend like you're coming out. Good. Come out of the patient's skin. You already gave it. You waited 5 seconds. Good. Now what do you do? Beautiful. Because no one's next to her, so she wasn't saying needle. See the difference? That was good. Leave it. Perfect. Don't worry, I'll take care of it. Awesome. So that was good. So it's just, I'm left with just you. So how was the process for the 4 of you? Any questions? No? Good, you're taking care of all the garbage. I like that. You're cleaning up after yourselves. Mademoiselle, cleaning up after yourselves, removing your gloves. You just dealt with somebody's skin and your blood, and those that still have gloves on don't need them. It's garbage, so you put them in the garbage. That back you're gonna.
This garbage?
No, that's you're gonna keep. Right, you get your practice. So the vials are for you to practice. If you throw in the garbage, I don't have another one to give you. So I give it as like a practice for you. It's yours. Good? So yeah, I use my needle, my pen as practice because it has a little plunger. So I pretend like, okay, this is the syringe, and I'm going to the patient's skin, and then I inject. Okay, I'm gonna hold for 5 seconds. Good, I come out of the person's skin. So I come straight out, up, and then I go. Needle, sorry, and then I go in. So you can practice even at home without a real syringe and still be okay.
Can you take it home?
Take what home?
This.
Right, it's yours. Yeah, I give it to you. No problem. Are there any questions so far? I'll help you in just a moment, just so I can get the next process going. You're holding it like this. No. Why are you holding? Do you hold the syringe like this? My students. Okay, so we're gonna end that process, and I'll help you with the other one so we can go on to the next one. Okay?